Thank you, everybody. It's a real honor to be here, and my thank you to Steve and to Tasha for the invite. I'm rarely in the region, but often impressed. Impressed because I see other innovation ecosystems and networks that don't work well together. They say they do, but when you're in those networks, you realize it isn't really working. And I do find that when I'm in this region, there is an intention to work together. There's a supportive nature. There's a mindset. And I love to see this when I'm here, so thank you. I would like to speak to you about something called the innovation journey. I have a very, very long essay that this is based on, which none of you have read. All right? And so I'm trying to boil it down to a few points and adapt it for you. So this is meant to be a conveyor belt, and there's a reason behind this. I am building up to point 5, points 1 to 5. But I'm going to start at the end. And the reason I'm going to start at the end isn't just because I think you won't pay attention, but because sometimes it's nice to know where we're going. So what I think I want to end with is the following point. I think that in innovation, we often look at point solutions. You've heard of these things. Solutions that are very specialized. Solutions that you put in without due regard to the whole. That point solution, people get annoyed about. They say that they don't want them, and they look at platforms. But sometimes the platforms are really generic. And sometimes that puts us in the pockets of organizations which hold us to ransom. I won't name them right now, but maybe in the break. I want something in between. I want a platform that enables the point solution so that you can have as many point solutions as you want, and the innovator has a conveyor belt into the system. And when you have that, then we can have as much innovation as we like. And I'm going to make a controversial point. I don't disagree with anything Jordan said, but I don't think we're as innovative as we need to be. When we compete against Singapore and Estonia and Israel and the Netherlands, and they see us as their lunch now. Brexit hurt, COVID hurt, Ukraine hurt, and other things have hurt us. And if we do not look after our strengths, we end up being viewed by those who are behind us as food. And we're looking at China and we're looking at the US as large scale or, huge nations. And we can't compete with that scale. So where do we fit? Therefore, it's not enough to be innovative. I'm sure there are lots of people who are innovative if we can't deploy it and it can't get adopted. So that's what I'm arguing for. My 5-point argument. I don't think it's nice to have. We need health innovation at scale. But we make it unnecessarily difficult for innovators. If you're an innovator in the room, I'm going to say this to you, and I know that you believe it. You don't have to say anything. You can just blink at me. If it's hard, if things aren't working for you, can you go public and say it's not working? Or do you feel sometimes I'm not able to say it? I don't want to lose the goodwill. And so all you do is end up complaining on a WhatsApp group. I've seen the WhatsApp groups. We expect scale without the infrastructure of scale. And that's a point that requires a thought experiment where I may ask you to close your eyes for a second. There is a friction of adoption and scale. You've heard the phrase spread and adoption. I don't like that phrase, and I'll tell you why. And finally, I want a mechanism to deploy the innovation repeatedly, which is why I mentioned it shouldn't be point solutions, shouldn't be a boring anodyne neutral platform. It should be a platform for point solutions. So does that all make sense? Right, you can switch off now because I've done the talk. You will find imagery with what I'm saying. You may not like the imagery. One of them is plumbing. The other is train tracks. The reason why is because I want to illustrate conveyance, but repeated conveyance. I could have given you a jungle and someone with a machete cutting their way through, and then finding that it regrows so no one can ever find the path. And that's what it feels like for innovators. Innovators keep telling me that they find the path and it regrows. And so no one else knows what that path is. And so you want to pave the path, but paving it isn't enough. That's why I want train tracks, because then we can convey as much innovation through as we like. This is the essay, 5,000-word essay that no one's read. If you are feeling that you can't fall asleep one evening, this is it. This is it for you. Okay. I was told, please don't write in small font size. And I warn you because the next slide, and you can have my slides, tells you the number of roles I have right now. Don't have to read it. The reason I gave you that was just so you get an idea that I'm working across the ecosystem, deliberately. I am fractional across the ecosystem, and I can see both sides, buyer and vendor. So, to point one, do we need, or is it a nice to have, innovation at scale? 3 quick arguments, of which I could make many. In the top left, this is a paper saying that we are losing our clinical workforce due to retirement. Bottom left, saying that we're burning our people out. And on the right-hand side, you see that we've got an aging population with polypharmacy and multimorbidity. Just those 3 alone mean that we're in a generational crisis. The World Health Organization, as I'm sure you all know, has predicted a shortfall somewhere in the region of about 20 million people for us to provide care worldwide, particularly in low middle income countries. And I think they've undershot that by a long way because we don't have the people to train the people that need to deliver care. This gives you an idea that we're really struggling, particularly because of this. This is the truth. It's not my line. Healthcare cannot recruit its way out of a retention crisis. How many, what we used to call junior doctors, are we going to keep? How many people are there in this country saying, I want to go somewhere else? It's not an easy situation right now. And we also have opportunities that I don't think we can leverage as we wish. So, generative AI. Everyone is talking about generative AI. And they're even talking about hallucinations, or as I think it should be called, confabulations. But let me ask you, this is the CB Insights market map. And it has, I think, 430 different innovations on this map. It's very American-centric. And on the left-hand side, it has the healthcare vertical. Do you think that we're in a position to take all of those point solutions and put them into our health system, into our care system? Are we ready for that kind of shock and that kind of disruption on top of all the other things we currently have? So then what's the value of having an innovation if you can't deploy, if it can't be adopted? That, for me, is the challenge. We cannot save ourselves from a generational crisis with that problem. This is a question that is deeper than it sounds. How are we going to explore, because when you're buying or commissioning, you have to explore the landscape. You need to look at a horizon scan. Procuring, contracting, deploying, testing and trialing, monitoring, auditing, and renewing. We have to do all of these things for every single solution. Do you think that we have the capacity to do all of those things for all the solutions that we need? For all of the different touch points, not just pathways, not just workflows, but touch points within workflows. I know this is going to hurt, but it's the truth. Modern healthcare is fundamentally undisrupted. We still do things largely the same that we did 20 years ago. We may have a different machine at the center of it, but the processes are the same. The way we work, exactly the same. We are incremental rather than radical. And this is this is again deeper than it sounds. We transfer rather than transform. So to transfer is that we have a new digital asset and we try and just do the same thing but with the new asset. We don't try to reimagine what we can do with a new capability. To give you a really bad analogy, this is a true story, I won't name the hospital. In one of the labs, there were a group of scientists, pathologists, all looking at the microscope. And they would all take turns to look at the microscope until someone said, why don't we just put the image on a monitor on the wall? Now, what does that tell us? It says that you could think about doing it differently. And that reimagining is the heart of digital transformation, which, by the way, none of the definitions seem to make sense. So that was my first point. We need health innovation at scale. Point 2, we make it needlessly difficult for innovators. For the innovators in the room, I feel your pain. And for those of you who have struggled, I think that you succeed despite the system. Even though there are people who are helpful within the system, they are few and far between when it comes to the volume of innovators that we have. They're not resourced enough. I feel for the Health Innovation Network because they are doing a fantastic job, but they're not resourced to do what's needed. And I honestly think that therefore we need a national conversation about what it means to adopt innovation. And it isn't for any particular single group to solve. Do you recognize long sales cycles? Opaque procurement. My favorite is when procurement asks for something which doesn't exist and could have been solved by putting 2 or 3 different vendors together. And if you do, instead of asking for a flying car, they could have asked for a helicopter. The tenders are unclear. Internal politics, we won't go into details. Accelerators that don't push hard enough. Well, I'm lucky to be attached to 5 accelerators. And accelerators are saying that they will do something, but the innovator's asking for something else. And those two don't always match up. So to the accelerator, they are doing enough. To the innovator, they're not. And this comes down to a very simple idea. You can't really work out what your product is until you start to sell. And you can't start to sell till you get the introduction to someone who actually has the problem. And that is called the mum test. Have you all heard of the mum test? It's a free book, actually. You can find it online. And the mum test is an idea that if you pitch, if the ego and the neediness that you have inside you comes out, people will hear that neediness and respond to it, effectively giving you the fake phone number. And they'll say to you, of course, yeah, great, send me an email, and then they'll run away. But if you can ask them about their lives and find out what they need, they'll tell you the truth. And that's why if you told your mum, your mother, oh, I've got this great product, and they hear the neediness, they'll think maybe I need to validate you. Avoid that. But how can you avoid that until you go to sell? And that's why what we need are buyer signals, demand signals, really, really clear, and having that matchmaking. These are all symptoms of misalignment, but in what? The mistake I think most people make is they go immediately to the innovation ecosystem. So this is the diagram from MIT, Sloan School of Management, which is not about health, it's general. It says that the innovation ecosystem generally has these 5 partners. I put the word NHS in there. But when they talk about the ecosystem, they mean these 5. And I think that's the wrong unit of analysis. And by the way, I do believe in the innovation ecosystem. I'm running the innovation ecosystem gathering, which you're all invited to, by the way. But you'll notice, look at the number of partners. And what I'm trying to do here is say healthcare is different. You have to gather interest groups and accelerators and the health innovation networks and the constituent elements of it. You need AWS and you need Dell and you need all of these organizations too. And if you don't gather the ecosystem that way, you can't trigger the value of an ecosystem, which, by the way, Professor Fiona Murray at MIT has made it clear. It's not the value of the innovator or the innovation, it's the place. Because if in a place you have talent, access to money, you have those introductions and interactions, the place becomes an advantage. And you can stack the deck by making more things happen, by bringing more people together, more capability together, more knowledge. That's why you have innovation ecosystems. That's what Boston does very well. That's what San Fran does really well. But others just bring people together and they don't stack the deck. And that's why I argue they're not innovation ecosystems. They need to be more like this. So I'm arguing the right unit of analysis is the journey. So if you speak to NHS England, they will show you a diagram which is very linear. But if you've been an innovator, you know that it's not a linear journey. You know that there are loops and dead ends and pivots. Your journey as an innovator is a very odd journey. I'm not even talking about the innovator's journey. I'm talking about the journey of the innovation, the actual solution itself, as it goes through regulation and standards and evidence generation. That's the journey that's misaligned. Who looks after that journey? In one sense, I don't really care about the company. I care about the solution, whether it's appropriate. Because if the solution's appropriate, it will scale. It will be adoptable. And that's when we will see it win. The company will win as a result. I don't need to help a company. I need to make sure the solution works. I want the innovation journey to be aligned. And often the tenders show that they're not. Often the accelerators don't think they're not. Evidence requirements, you have to do 3 or 4 different types of evidence. Why can't we standardize? So that's how I think we make it needlessly difficult for innovators. What do you think I mean by scaling without the infrastructure of scale? A digression. I don't care about scale either. If you're an innovator, I care about product market fit. For those of you who don't know what product market fit is, Mark Andreessen wrote this many years ago. He asked, what's most important? Is it the team? Is it the product? Is it the market? I'm going to ask, would anyone like to suggest an answer? Team, product, market. Anyone? Market. Great. The market wins. A baseline average product with a decent team and a great market wins every single time over a fantastic product, fantastic team, poor market. And if you get the market right, you win. That's how you get scale. Now, I'm going to tell you something which is true, and I think it's true. If anyone wants to disagree, happy to have the challenge. I think we have in healthcare the problem of selling once, and then when you go to sell a second time, it's going to be subtly different, meaningfully different from the first time. Then the third time you sell, it will be different from the other two. When you get to sale 71, it's going to be different from the previous 70. You're going to get to sale 73, and each time you've had to do something different. And that's the problem. You've had to sell in a different way, talk to a different job title, go through a different procurement, talk to procurement in a different way. And each time you cannot sell with the infrastructure of scale. This is a very silly example of scale. But have you ever noticed that when you get your toilet roll, the center of the toilet roll is always the same size? You know about USB? Peripherals? We always try to make it easy for things to grow by standardizing. But the journey for the innovator and the innovation is not standardized. And without that synergy that you get of being able to have everything work, you would be a bit like, and unfortunately, I only found a US picture here, but imagine that you're rowing without the cocks and you're all rowing at different strokes. You don't get the power and the synergy, and then Singapore overtakes you. I want every sale from 1 to 73 to be the same, just like the first. So the thought experiment. My clicker has gone. Okay. This is a thought experiment. You don't have to close your eyes, but it'd be nice if you did. I want you to imagine that you buy, whether it's an Android or iOS, you buy your phone and you think to yourself, I want to download an app. You have an app store. When you download the app, there's already been a deal made for every single company in the app store. They know how much they're going to get. They know how they're selling, and it comes onto your phone without any issues. That is the point solution with a platform. And sometimes when people talk about this, they only focus on the marketplace. They don't realize that the plumbing and the train tracks that got you there is the real innovation, not the marketplace. The marketplace is a symptom. Now, here's a thought experiment. Imagine that I give you a phone with no app store. How would someone sell to you? They would have to come and find you individually. They'd have to ask you, download onto your phone. They might make it easy with a QR code, but they'd have to find each one of you. Imagine that they want to get to the third sale. They'd have to find a third person. Could you scale if you had an app and you tried to get it onto someone's phone and you didn't have an app store? You would struggle. How would you get across China? You wouldn't. And that's what we're asking our health innovators to do. They have to go from ICB to hospital to clinic, every single one of them individually. It's ridiculous. I'm running out of time, and my clicker is slow. Thank you. We expect people to scale without the infrastructure of scale. And we go to the next slide. I'm going to be quick here. I'm showing my age. For those of you too young to remember Kevin Costner, I'm so sorry. This is the problem. The assumption of many innovators. The innovators bias, you build it and they will come. I feel for you if you're still thinking that that's the truth. There is an inverse relationship. If you make things adoptable, easy to adopt, then it will scale, right? But you've got to make sure the friction is low. And the friction, remember I said, to find it, to then contract it, to deploy it, to gather the evidence for it. If you make it tough for an enterprise to bring the solution in, it won't get used. I wrote an article. I don't write many articles. I just shoved all of them into this. I said it's the friction that matters, not the point solution. There's a long quote. I've long maintained that the biggest single reason that companies in our sector struggle is that they make it difficult for buyers to adopt. And by adoption, I mean the whole thing. Which pot of money are you going to go for? How do you write the business case? How do you then bring it in and then go through IT? All of those things are individual battles, and they are so draining that anyone in the room who's a good innovator has already got grey hair. Those of you pointing at your grey hair, I'm sorry. This is the spread and adoption diagram that you see from NHS England. Forgive me, I'm going to say it very bluntly, I think spread and adoption makes no sense. It's got to be how adoptable you are before you scale. In fact, I think it's be adoptable in order to scale, not the other way around. Another article, I talk about the human factors. Briefly, if you're going to ask an organization to do something that's going to make the job harder for the individuals, they won't adopt it. I've put a picture of a minefield here. The minefield is what we give to the innovator because they have to keep struggling through it each time. Imagine that you go through a field and the mines are in different places each time. It's not fair. I'm almost at the end, so I will say, we must install plumbing so that we can deploy innovation repeatedly. That's my conclusion. I'm not obsessed with food, but this makes me think of a conveyor belt for sushi. Or what I call the train tracks thesis. And briefly, plumbing and infrastructure, helping the different stakeholders align on both sides. And if you can do that, then the marketplace makes sense. And the article that I wrote, the essay I wrote, is saying that this is the trend that I can see in the world. People are now moving towards that model. So we have to now change our expectations of innovators and health systems to make sure we enable point solutions and convey them in. You might wonder, why did I mention the Wild West? The end of the Wild West happened for 3 reasons. One of them was because of barbed wire. You were able to fence off land. Another was they reached the end of the frontier. But the most important reason was the train tracks. They were now able to get from the East Coast to the West Coast, rather than a 4-month journey and worried about whether they'd get killed and robbed. They could take the train. So I told you that I was going to start at the end. You now know why I talked about the train tracks and the plumbing. My 5-point argument: we need health innovation at scale. We have no options. We make it needlessly difficult for innovators. We expect scale without the infrastructure of scale. There is a friction of adoption and scale that we abandon them to. We need a mechanism in order to deploy innovation repeatedly. If you'd like to discuss with me, I'm more than happy. This is a QR code to reach me. Very happy to have the conversation. Thank you.